Hi everyone, we are hopefully live now, and if not, let me stall for time a little bit so you don't miss anything important. This is FtBCon 3. It's the third time that the Free Thought Blogs Network has run this conference. We're very, very excited. Since this is the first full session, let me just give like a little bit of an overview of what we're doing in case you didn't see Stephanie's earlier. So if at any point during this weekend you're confused or you don't know what's next or you don't know how to get to a panel to watch it online, the best thing to do is just to go to ftbcon.org where all of our links will be popping up. You can also follow us on Twitter at FtBCon, and we also have a Facebook page. In order to chat with other attendees or submit questions to panelists, you will have to go to the Fringula IRC chat room, and the best way to get there is actually just to go to ftbcon.org and click on the link at the right, because it's one of those long convoluted URLs. We do have a harassment policy, and it's also up on our website. I suggest reading it over, but I don't expect that there will be any problems. And finally, the FtBCon Twitter handle is the only official FtBCon Twitter. There might be a few people trying to steal our spotlight, but we know that that's not legit. So this is the first full panel. It's called Treating the Brain, Skeptics Talk Therapy and Therapists. We're just going to be sharing our experiences with therapy and what we know about it, and maybe tips for others who might be looking for therapy themselves. There have been FtBCon panels in the past that were more about the experience of mental illness in general, but we decided that this year we were going to go straight to talking about therapy itself and hopefully give people some useful information just about our lives and about the research and whatever else we talk about. So this is sort of going to be self-moderated. The first thing I'll do is just to ask everyone to introduce themselves, starting with James.
Hello everybody, I'm James Croft. I am the leader in training at the Ethical Society of St. Louis. The Ethical Society of St. Louis is a large humanist congregation in St. Louis, Missouri, so it's sort of like an atheist church, and I'm training to be one of their professional congregational leaders, and I've been in that position from the end of August. And before that, I studied human development at Harvard for like 45,000 years.
And Misha? And Nikki?
Hi, I'm Nikki M. I write for the Seriously blog at feminace.wordpress.com. You can see it on the lower third, how that's spelled. I am very much a layperson who has seen her share of therapists, so that's what I'm here for.
And I'm Miri. I write the blog Brute Reason on the Free Thought Blogs Network. If you've ever read my blog, you know I talk a lot about mental health and mental illness, so I sort of have a lot of experience there. I'm also in my second year of a master's in social work program, which means that I already have direct experience providing therapy, and that's what I hope to do with my whole career. So the first question I wanted to ask our panelists is, what have your experiences with therapy been like, and how did they conform or not conform to your expectations of what therapy would be like? And feel free to just jump in. You don't have to go in order.
Guess I'll hop in next. My first therapists were school counselors because I had a hard time explaining to my parents what's going on in my head. But when I finally got older and moved out, I started seeing people for depression and anxiety and things I struggle with. And I've had a lot of varied experiences. People who give me worksheets, people who just let me talk, people who let me who laugh with me, who share their own stories, and a couple of therapists with which it just didn't work out. We didn't click, etc. and so on. So I right now I'm currently seeing someone and we get along really well. It's just a pain in the butt to get into her schedule. I literally have an appointment in 3 months, and that's the first time I will see her since the new year started. So boo.
So I've seen a few different therapists, never for very long at a time. So I've had depression for a long time, and originally when I saw therapy, it was because I was sort of in the thick of it. And I found that it did not help. I think for a number of reasons. I think that the therapist that I saw didn't really know how to get me talking about what I needed to talk about in order to get better. It was sort of like, how was your day today? And I'd be like, oh, I'm really stressed because I have this big exam on Monday, because that's what was on my mind. But they never really took that and went any deeper with it. I also had a therapist who would say things like, you need to learn how to self-soothe. And I'm like, well, no shit, that's why I'm in therapy. At the time, it came across really, really condescending, actually. And I learned later that self-soothing is usually a term that's used to refer to babies and the way that they keep themselves from crying. And obviously it can have its corollaries in adult behavior as well, but I was like, wow, no wonder I feel like I'm being spoken to like a child, because I sort of was. Yeah, and I guess I expected based on, so I mean, I knew a lot about how therapy is supposed to work because I was studying it in college. This was by the time that I went to therapy. But I expected for there to be more, questions that were trying to get to the bottom of what was really wrong with me. Not sticking at the surface level with my school stress and my relationship problems and my social issues, because these are some of the ways that depression manifests itself, but they're only the symptoms. They're not the cause. The cause of my suffering, I felt, was because, well, obviously, I don't have a boyfriend, and I don't have close friends, and I'm away from my family. But that was not really the cause, as I learned later. The cause was that I had learned all these really maladaptive ways of thinking. So I recently started seeing another therapist, even though I'm mostly okay now, just because I want to, I guess, work on some aspects of myself. And it's too soon to tell how that's going to work out, but even then, I can never escape, the condescension and the, well, of course, at your age. How the fuck is my age relevant to this? We weren't talking about my age. So yeah, maybe the answer is for me to find a therapist closer in age to me, or just one who can see me as more than just a young person in need of their saving or whatever.
The term self-soothe icks me out. I've never heard it, and I don't want to hear it again. I first went to see a therapist when I was in a long-term relationship with a woman when I was about 26-ish years old when I started to go see someone, and I was struggling with my sexuality, and my girlfriend at the time suggested that I go and see a therapist to talk to someone about it. It was not something that I had done, and I kind of came from a background where I wouldn't say it was stigmatized, but I think I thought of it as something that you do when you're not well. And I kind of thought of myself as kind of struggling with something, but I was kind of well. And so I didn't think that I would go to see a therapist. But she is from Germany, and in Central Europe or some of these countries, they have a much different approach to therapy, where it's just a part of your sort of health regime. And she had been seeing a therapist for many, many years, routinely, even when there wasn't anything particular to talk about, and she recommended I do it. And once I found a therapist I clicked with, and it was very much like dating. I think of therapy as sort of weirdly similar to dating in the fact that you kind of have to get to know the person, and you kind of, maybe it will work, maybe it won't. But once I found someone who I felt I had a good relationship with, I totally loved it. Not every experience was perfect, but I really enjoyed the process of coming to know myself better and finding stuff out about myself and why I do the things I do and why I think the way that I think that I didn't know before. And it's been extraordinarily valuable. And now I've tried to shift my thinking towards therapy as one where it's just part of, I try and think of it as how I think of physical exercise. I hate it and I never want to do it ever. Really, I try and think of it as something I should do regularly just to maintain my mental health and to continually explore myself. And so I've had a number of therapists over the past few years. I had one while I was at grad school who I really clicked with and who I really liked and who I went to, once a month or so for a good period of time, where even when there wasn't anything specific that I felt I wanted to talk about. And I just loved the process. And then since I moved to St. Louis from Boston, I've been trying to find someone else to work with, and it's been challenging because I haven't really found anyone who I have the same sort of relationship. And I think that one of the things that made it positive for me that first time is that I came to it as an adult. I felt I was in control of the process, and I was going there with a specific need, and I knew that if I wasn't getting that, I was okay to leave. And because I was in this great relationship with someone who was encouraging me to do it and who saw it as a totally routine thing to do, this sounds like a potentially stigmatizing thing to say, but it was important for me to get in the door to think that I didn't have a mental health problem. And I wasn't admitting to having a mental health problem by going to see a therapist. Now, I realized, of course, that I did have lots of mental health problems, and I do have lots of mental health problems and challenges. But it's this weird kind of dance to get in the door the first time where I was like, I don't want to think of myself as mentally ill. Now I'm quite happy to think of myself as mentally ill. I think it's just, or at least a little bit, things to work on. So I kind of like therapy when it's good. I really hate it when it's bad. And I'm looking for a new therapist right now.
So the other thing I wanted to ask about actually relates to that. I'm wondering what everyone's best and worst experiences in therapy are, and it could be like, kind of like what you said, an experience with a specific therapist, or like a moment. So like I had that crappy, like, what do you mean I have to teach myself to self-soothe? I feel like a baby now. So let's start off with best experiences.
Well, I can start off with the worst is I mentioned worksheets. I have this thing about anything that reminds me of schoolwork freaks me out. So I had this therapist back in Boston who I think more or less he was in training because he told me not to call him doctor. But most of the times we got together, it was, here's some printouts, do this. And I would look at them and my heart would just race, but I would feel so bad about feeling a worse failure when you're just like, oh yeah, I totally did those, I just forgot them at home, and it really didn't help me very much if I'm freaking out before I get there because I forgot to do some busy work, which is what I just call that busy work. I can't really focus and I never had the nerve to tell him. My best experience was the therapist that I had before my current one. He ended up retiring. And he was pretty awesome. We would have these great sessions where we would talk, and he gave me printouts, but there were things from like books he had been reading, or just they were things that I could use to like enhance my mind, but not have to cough up, handwritten pages of, well, right now I feel like this, and this is what it feels like in my brain, and blah, 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 blah. So yeah, we got along very, very well, and to be quite frank, I kind of miss him.
It's actually hard for me to say what my best experience was because I didn't stick with anyone long enough because there wasn't really any good there, which is funny coming from someone who's training to be a therapist. But I very firmly believe that some of my issues there were caused by the person being incompetent, and some of them were caused by them just being a bad fit for me as a client. And we'll talk a little later about like how to tell the difference between that and about the fact that, like James said, you do sort of shop around for therapists almost like you're, going on a bunch of first dates. But I will say that a really amazing experience I had was actually a therapist with whom I had one session. I couldn't have any more because they weren't covered by my insurance and I couldn't afford $150 an hour. And this was in college, and at that point I was struggling with a relationship that I wasn't even calling a relationship. It was very casual, but at the same time, it wasn't like your typical friends with benefits, whatever type of situation. And it was really hard for me to get people to acknowledge that this was important to me, even though it didn't fit the definition of, what we sort of want relationships to look like. And I was experiencing difficulties with this person. And in my first session with this therapist, I shared that. And I don't remember exactly what she said, but she said something like, yeah, I can see that this person is really important to you. And that was the first time that someone's initial reaction wasn't like, oh, why are you letting this guy string you along? You deserve better. She acknowledged that this was a close friend, and I cared about him a lot. And maybe there were problems, but, first she validated that for me. And unfortunately, I didn't get to see her again, which was really too bad. But as far as my worst experience goes, I guess this is sort of typical of the sort of treatment that I received as a young person in therapy. And this was, I was sharing difficulties that I'd been having with my parents in terms of like dividing up housework and the fact that they sort of expected me to volunteer to do things rather than coming to me and asking me to do things. And I said to my therapist that I found this frustrating because I dislike being expected to read minds. I don't know what they need done. And she said, why don't you want to help your parents with the housework? Because she had clearly put me into this role as the, willful daughter who wasn't, wanting to help her parents, whereas my struggle was with a breakdown in communications and a culture clash, and the fact that my parents wanted to communicate one way and I only felt comfortable communicating another way. That all completely went out the window. In her eyes, I was the silly little teen who didn't want to help at home, who just wants everything handed on the silver platter, and that's how I felt that I was being treated by her. She didn't ask for my perspective, except in asking why I wasn't doing my share of the housework. And I don't remember how many more sessions I saw her after that, but after that I didn't really want to come back.
Yeah, I can relate to that. Wow. My best experience was definitely the guy I saw for the past year or so when I was in grad school. And he is a wonderful human being, and I really miss him, and I wish I could go and see him again. He was very smart, funny, kind of playful guy. He was a gay guy as well. And he called me on my bullshit in a playful way. He was willing to work around all the barriers that I was putting up to stop getting to the kind of like a bit of a game, but he could win. And very often my bad experiences is I knew I was winning, and I was like, well, you can't help me because you can't get around the things I'm putting in my own way. So, and I know it, and so it's not going to help. But he could keep up with all the maneuvers I was making, and he was very friendly. I felt comfortable with him. I trusted him because I thought he was smart enough to do this with me, and I particularly felt like he wasn't taking me through a stock routine. I didn't feel like this is what I do with all my clients. We start here, and then maybe one day in 10 sessions that you've paid for, we'll get to the issue that you came in and said you wanted to talk to me about. He started where I wanted to start, and he listened to what my problem was, and he actually offered advice and strategies, which I find a lot of therapists don't do, but I like. I actually want to be given something to do if it helps, and the stuff that he gave me really helped, and I really enjoyed working with him, and I'm trying to think if I can do like distant sessions with him because I'd like to see him again. My worst experience, I've never had a really bad experience, but the bad experience that comes to mind, I think, shows how difficult therapy can be and how tiny little things can really break a relationship, because I don't see this as a big issue, but it was another guy who I was seeing while I was going through the coming out process. I was identifying as a questioning, straightish guy, and someone referred me to this guy because he was a young gay man. He ran a men's group for gay questioning, bisexual men, and I wanted to join that group. I thought I was going to see him so I could join that group and discuss with other people who are in a similar position to me. And he was very young, like only a few years older than me, and very good looking. Like I was desperately attracted to him, which I feel like a little bit is useful, but too much is not. So that was a bit challenging. And I was in a real struggling place with my sexuality right now. I was very unhappy. And I said that I would be joining the group, and I was so excited to meet him to join the group. And his response was, well, if we let you in. And that tiny little thing made me feel totally like I was being judged. And like the purpose of me was sort of to interview to see if I was worthy of getting the care that I thought that I needed and that I was getting. And it just poisoned the relationship. I did join the group, and there's a great story about how I came out of that group. I won't tell you yet. But so I didn't like stop seeing him, but it made me very wary of him. I suddenly didn't trust him and the relationship because I don't want to be judged by my therapist. And that just kind of sticks in my mind as a particular turning point, and that's kind of soured a relationship.
So it sounds like what we've really been getting at is that, like, sometimes we need different things from therapists. So, for instance, Nikki didn't like the like all the homework and the writing, whereas I personally would really love that. And it's a problem when therapists have like these pet perspectives that they're unable to budge from. So they assign homework to everyone, even though Nikki has an anxiety about that. Or they think like, oh, I don't need that silly stuff, we'll just talk, and they don't offer it as an option to someone like me who might really benefit.
Can I just jump in real quick? I realized something that I was going to mention before, that I also have received the self-soothing bit from a therapist, and I had to stop her real quick and let her know that no, see, because I don't need a binky, I don't need a pacifier. Like, I'm a grown woman. I know that. I know what she was getting at, being anxious, having anxiety attacks, having a way to get yourself out of there. But let's use any term other than that. Now, to your point, that I've noticed that a lot. That there is just this one way, and this is the way that works. This is the way that always works, especially when they talk about using this with other patients, and you have to stop and go, well, I'm not your other patient. Let's think of something else. I mean, you got lots of book learning. Come on, let's work this out.
Mm-hmm. Have any of you had any experiences where the therapist demonstrated a failure in what we call cultural competency, which is basically the ability to work effectively with a client who differs from the therapist on some dimension of identity? So often that's race, but it doesn't necessarily have to be race.
Race. Yes, race. Having to deal with a counselor who didn't particularly listen to me very much when I was talking about my issues with identifying as a black woman. I had this weird disassociation problem, and pretty much her thing was, well, why don't you watch a couple of black movies? Here, why don't you watch Waiting to Exhale? Here, recent Toni Morrison. And I'm like, well, the problem is I don't identify. Why are you doing this to me? And I get a lot of, I used to, my favorite therapist, he was great except for the whole asexuality thing. Having to explain to him what exactly that means. Like, we're not, that's not part of, the medicine I'm taking. It's not part of my depression. It's a completely separate thing that I'm okay with now. Can we move on to something else?
I made an effort to try and seek out, like when I was particularly dealing with issues of sexuality, I sought out gay male therapists because I didn't want to, I wanted people who had at least some similar experiences to me, and I assumed I'd be able to get that way, and I haven't yet experienced an issue on a sexuality issue like that. The one time I thought I might have an issue but didn't have one, which I think illustrates a really good professional practice in this area, was I actually the favorite therapist I was talking about. I learned, and this is another thing I liked about him, was that he was willing to share some aspects of his own life, which I really appreciated. I found out that he was a Mormon, a gay Mormon, and I was kind of surprised because I presumably had some prejudice that you couldn't be a totally cool, chill gay Mormon, and I was kind of puzzled by this. And one of the things I loved about the work that we were doing is that he got how important humanism is to me, right, and how I was going to pursue it as a career, and it was kind of like a sort of ordination, and how I was really into it, and he would talk with me about how my values related to the struggles I was going through, even though he clearly didn't share precisely my metaphysical outlook or my religious values. And I think that that's great. Like the fact that I knew that he was of a different religious perspective than I was, but I felt like he respected my perspective in that professional space and was able to sort of enter it with me and understand how important it was to me. He could have totally failed that, and he didn't. And I think that was really neat. I love him. I'm going to give him a call.
I think, again, I didn't stay with anyone long enough for them to sort of really commit too many microaggressions. But I noticed that especially I think when you're a young woman, like you encounter a lot of heteronormativity from therapists. And it's interesting how, I'm looking back on this now. I was I was openly queer, but I was only dating men, and I was presenting all these issues that I kept having with these male partners that I was dating, and I wonder why none of these therapists thought to ask me about women, and what that was like, or what my perspective on dating women was, because I wish that someone had actually put that into my head as like a viable thing that I can do much earlier on. I think my life would have been much more interesting and healthy had that been presented to me. Instead, they sort of stuck with the whole, I'm a woman, that must mean I'm only interested in men. That must mean that on some level I need to make myself desirable to them, and that some of my issues revolve around that. And I've tried to find queer-identified therapists for a while now because I just feel like they would understand some of these experiences a lot better. But here I run into the issue where for some reason LGBTQ therapists are all really into their Freud. And for those watching who might not know, Freud and psychoanalysis are not based on scientific evidence, and they're also, that tradition of therapy is also very sexist and homophobic and basically everything else, and I don't understand why every time I find a queer therapist, it's all psychoanalysis all day, every day. So hopefully one day, maybe it's also because I'm in New York and that's really big here, but hopefully one of these days I will find someone who practices from the perspective of scientific evidence.
I would love to raise up just that last point about the problem of non-science-based practices in this field. This is not my field of expertise, but I have studied and done research in human development, which includes psychological development, and there is a lot of sort of folk wisdom and very, very outdated practices. As part of my professional role now, I have to offer pastoral care to our members, and I'm not qualified to do that, so I've been looking to take courses in pastoral care, at least, to get some level of proficiency around that before I take on a sort of a real professional role doing that. And a lot of the courses, at least offered in this area, are based on not just Freudian psychoanalysis, but Jungian techniques and other sorts of paradigms that are not only really quite old, but also just not well respected from the sort of more mainstream scientific literature. And that is a problem for me. You know, I won't take a class in something that I think is based on a set of discredited or even just unproven assumptions about people. And I found that a couple of times going to therapists where I like to kind of ask them straight up what their approach is. What is their theoretical basis? Some therapists really dislike this, and that shows me that they really don't want my time. And if I hear, you know, it's kind of a Freudian approach, I'm like, I'm actually not interested in that. I want something that is more scientifically valid.
So how have some of you gone about finding therapists, whether that turned out to be helpful or not?
I've had insurance like sporadically until a couple of years ago, so it was literally look in the big book and see who is available and cross your fingers and hope for the best, which is probably why I've had some hits, some misses. But it literally is whoever will take whatever insurance I happen to be on at the time.
I started just using the person who I was sort of assigned through the student healthcare plan that I was on, and luckily that covers a certain amount of visits to mental health professionals, and they're generous with that, and it's really quite a good quality of care. But it was I was clear with some of the people who I just happened to see because they're the person who was available, that I didn't really find that the connection was exactly what I was looking for, so I just tried to say I'd rather see someone else. Or it always feels awkward to say that, but I think you kind of have to advocate for yourself. And then since leaving that, I can't use although I still am covered by my student healthcare because I'm still a student right now, can't use it out here in Missouri because I'd be out of state. So I've been trying to kind of shop around, and the first person I found out here was through a network which specifically specializes in providing counseling for clergy people. And since I'm in a very similar position now, I wanted to try that out. And I think that one of the challenges I had there was a lack of understanding that I was really clear that I wanted a non-theistic, like if anyone mentions God in that thing, I'm gone, like super out the door, like right that moment. I'm like, nope, sorry, not what I came for. And so I was never quite sure the person I saw really understood kind of what I was doing with my life and why I felt it was important and why I cared about it. And I couldn't get a read on what they thought about it, and that seems like a weird thing to say, but it made it a little difficult. And I went to see that person twice, and I didn't go back. And now I'm not sure exactly how to find someone else. It's a bit difficult.
Yeah, when I had those therapists in college, I actually just found them by looking on my insurance website, and if you're fortunate to have insurance, you'll usually be able to use its like doctor search function. But the problem is that that gives you like no information but their phone number and their address or whatever, and everything else you sort of have to vet for yourself. And of course, you know, the advice here is like, oh, call them and ask them all these questions and ask them, you know, what their training was like and what perspective they practice from. But first of all, calling can be stressful. Talking to someone who you perceive as having, like, you know, power or authority over you can also be stressful. When you're currently mentally ill, that becomes even more difficult. And if you know, don't have a lot of knowledge of like the different schools of therapy, you might not know which questions to ask, though we'll get to that later so that you do know. But there are also other ways to find therapists that will give you more of the information that you need, and one of them is Psychology Today magazine, which I make a lot of fun of because it's like sort of the clickbait version of psychology research, and then some of their blogs are not really based on evidence at all. But they do have a very useful therapist finder tool, and you find it if you just go to their website, and it gives you like all these options that you can filter therapists by. So what insurance they take, and what types of issues their expertise is in, and in what perspective they practice from. And obviously some of them might put down like, oh, I totally practice with LGBT people when maybe they don't really, but that is not something likely to be put by someone who's very homophobic, for instance. So it's still partially a good way to vet people. Other options, especially if you don't have insurance, are actually to look for local agencies that serve people who, you know, have an identity that you have or that struggle with issues that you struggle with. And there's like a lot of community-based mental health centers that do that. So often if there's like an LGBT center in a given city, they will offer counseling, sometimes sliding scale, which means you basically pay what you can, or even free. Or like women's organizations or shelters and things like that. And if there is a university, then you can also get free or sliding scale therapy with their trainees. And I know that that might sound like, oh, I don't want just some intern, but especially if you're in a position like I am, where you're young and you're looking for someone who's gonna get the atheism, or they're gonna get the humanism, or whatever, you might actually have better luck with someone who's a little younger and maybe less experienced and maybe less sort of full of themselves. Because, like I was saying with the issues I had with my therapist, they very much saw themselves as being like over me. They have this expertise. I am just a young adult or an adolescent or whatever I was. So, you know, your mileage may vary, but that's some other ways that you can find them. And in terms of finding a therapist, once you do get one and you meet with them, what are some red flags or green flags that you might look for?
If they care to pronounce your name correctly. I consider that my personal little thing. My legal name is really hard to pronounce. It's actually how I vet most of my doctors. If you actually care enough to figure out that part of me, then you're past the starting gate, and we can move on from there. Also, if you're willing to listen to me, hear me out, don't try to talk over me, don't try to do the whole, you know, I know what you need right now, just, especially during intake, just let me talk.
I love that idea of collaboration. I feel like that captures a lot of what's worked in the therapy relationships that I've really enjoyed. I have little things that I haven't thought about them before, so I appreciate the question, but I kind of feel like if they make me laugh during that session, I feel like that's a big green flag, because it suggests that firstly it's not going to be a solemn experience, and I don't, even when it's serious, and I've gone to some therapists with some issues that I considered very serious, I don't want it to be solemn and stiff. I want it to be, I want them to be able to bring levity into it. I want them to have an emotional sense and not maintain this sort of very strict barrier, which means that we can't engage with each other emotionally. So if they can make me laugh, that's a good thing. And I don't know if this is a fair test, but it's how I kind of judged whether I really wanted to go back and see the person who I've been seeing recently. Do I actually feel better after I go to them or not? It sounds like a very silly thing, and maybe it's not fair to ask that for certain things so that you actually feel better after one session or even two. But I realized I was going to see this guy, and in this instance I was paying for it, and it is a lot of money, and after I left I felt worse. Like I felt like I just dumped all my stuff on the table, and I had re-engaged my mind in all the stuff that I was struggling with, and I was lost without any idea of how to deal with it, and then I go home and pay them $150 or whatever. And I was like, that doesn't feel like a great use of my time or my money or my emotional energy. Whereas with the ones that I've really worked with, even if the issues are not resolved when you leave, but I actually felt more capable or more in control, or a little bit like I just felt better. And I'm not sure whether that's a fair way to assess, but I think that's how I've been doing it.
So I think it's definitely the case that, like, sometimes you feel bad after a therapy session even though good work was done. But I think sort of the therapist should explain to the client why that sometimes happens and sort of how to process that. They shouldn't just be like, okay, time's up, and you're like crying and you just have to go back out into the world and be your, you know, normal non-therapy self. But otherwise, yeah, like, I think that is a good metric, because even if it doesn't help immediately, you should gradually be feeling better, and you should leave feeling understood and affirmed and sort of legitimized, even if maybe, you know, everything isn't better right away. And something else that I tend to look for is knowledge, not just of, like, therapy and psychology, but of, like, human sort of identities and communities as they currently exist. So sort of when you're not white or straight or able-bodied or, you know, any of that stuff, you often find yourself in the position of educating the therapist, because, you know, and it's not necessarily that they don't care or that they're being oppressive or anything like that. It's just that they don't know, because they have the privilege of not having learned this shit. And you know, I often hear from therapists like, oh, yeah, so I might not really understand this, but I'm open to hearing about it from you. And I'm like, well, that's nice, but I'm not here to educate, otherwise the money would be flowing in the other direction. So, you know, I understand that they might not know everything that there is to know about everything, but if I identify or label myself some way, I need them to at least know what that is and to have read about that a little bit and heard of it. And I know that's not possible for all therapists because there's a lot of information out there, but that's something that I need as a client. And another thing is just sort of what someone mentioned, like that perspective of collaborating rather than teaching or treating or curing or any of that. Like, therapy should be a collaboration. And that's like a huge break from the earlier psychoanalytic models of therapist as expert, who sort of sits behind you and sort of listens very passively or dispenses information to you. Another thing is that I really like a little bit of self-disclosure from therapists, and that's something that there's always like a very excited debate going on in my classes about that, because a lot of people are like, no, that's inappropriate, and I wouldn't want to know if my therapist is married or has kids or is gay or whatever. But I think in some ways, like, that also can be a privileged perspective, because I need to know where I stand with people. And obviously, it would be nice, it would be lovely if my therapist accepted me and understood me no matter what their identity or life experiences are, but that's not how it works. So if I know that my therapist is straight, then that changes how I approach them in ways that are going to help me feel better in the session. If I know that they're not straight, then I'm like, cool, okay. So a little bit of that weight is off my chest now.
I actually had a pretty good, like, set moment with the previous therapist. He was gay, and we'd love to talk. And I write gay romances for my secret identity. And I told him this, and I actually was kind of more scared to tell him because I was worried about somehow offending him. But we both bonded over this weird little thing, and he'd showed me like the picture of him and his husband when they got married here in Minnesota the year before, and it was just another way to bond that I would feel comfortable, opening a vein and letting out all of my feels. So I actually like knowing a bit more about my therapist. That humanizes them to me. That puts them, as opposed to, hi, you're a smarty, smart person, and you're like here. But no, you're human. You have kids. In the case of my current therapist, who was very thankful that I was wearing a mask when I was sick and saw her last. So I'm like, oh wow, you're a person. Good.
I just totally agree with that. I think that for me, you can have all the professional expertise in the world, and you may be wonderful at what you do, but if I don't trust you, I don't trust you, the person who has all that expertise, it's worth absolutely nothing, and it doesn't matter. And I've certainly had therapists who I recognize they were very smart and very well educated, and I respect that. But it really doesn't make any difference to me if I do not feel comfortable sharing my deepest secrets with you, and that is a personal relationship, whether you want it to be or not. So yeah, just that if that barrier is too thick and I can't get any read on what they are thinking or feeling in response to what I'm putting out, I get very uncomfortable because it's such an artificial situation. I'm usually very good at picking up that sort of thing, and I want them just to reveal a little bit about themselves and about what they're thinking about what I'm thinking. And the worst is when they think that I can't tell what they're thinking about what I'm saying, but I can't really tell. That's the worst.
Yeah, they don't, have a monopoly on being able to read people. And actually, what you just said, James, is very much backed up by the research. There's a concept that's called the therapeutic alliance, which is just sort of the sense that both therapist and client have that they're on the same page and they're working together and they're collaborating and there's trust. And research consistently shows that that's the most important factor in determining whether or not therapy is going to help. It's not what type of therapy they practice. It's not anything to do with even like years of experience or training or anything like that. It's whether or not that bond has been established, which is why I always tell people, people tend to gaslight themselves a little on therapy. Like, they'll start seeing a therapist and they'll be like, oh, I don't know, I just don't click with them, but I feel like I should stay because maybe it'll still help, and, they're really smart and they have so much experience. And I tell them the therapeutic alliance is the most important part. So if you've been there for 2 or 3 or 4 sessions, and you're still not feeling like you have any sort of connection with them or like you can trust them, then it might just be time to move on. Kind of like you said, James, in a relationship. And there being a therapeutic alliance doesn't necessarily mean that you immediately feel comfortable sharing everything or that there's never a misunderstanding, but it does mean that there's the sense that this person is very much on your team. Even if they challenge you or even if they disagree with some of your interpretations, that's all part of the process.
I I take it the same way that I do with my doctors. I like to remind myself that it's their job to help me, and most importantly, I'm the one who is paying the premiums that pay them for to help me out. So if I'm not getting anything out of it, then I'm wasting my time and money that could be going towards someone who could help me. So that helps. That, in theory, helps. Let me put it that way, because even with that in mind, I still find it very difficult to speak up because of that whole power differential. Like, maybe they know better than I do, and I'm just being difficult, blah, blah, blah. But if that's only a bit of advice I can give to anyone, that is it. They're working for you. You're paying them either directly or indirectly. Keep that in mind.
Yeah, I think that's a really good point. And I think, like, sort of like Nikki said, it can be really hard to speak up in the moment. I mean, first of all, because this person is in a position of authority, and a good therapist will recognize that and will sort of set the tone for you to have that space. Like, something I like to tell clients who are, who are clearly a little bit uncomfortable with the process of therapy is that I remind them, first of all, that I'm still learning, and I don't say that just because I'm an intern. I say that because I will be still learning for the rest of my life. And I tell them that if I say something that really rubs them the wrong way, or that sort of makes them uncomfortable, or that they feel is a microaggression, I don't necessarily use that word because not everybody knows what it means, but I sort of convey that that's what I'm getting at, that they're welcome to stop me and tell me that that doesn't work for them. And that doesn't necessarily mean that they're always going to have an easy time of it, but it sort of sets the stage for them to see that I'm someone who will take that as like useful information. Like, I would thank someone who said that to me because they're helping me be better, not just for them, but in general. So when I'm back sort of in the client chair, I try to think like, the same things that you might say to other people. Like, say you were just trying to vent and someone starts giving you advice, you could be like, oh, actually, I wasn't asking for advice. I was just telling you. And, like, advice is, like, a contentious topic in therapy because, on the one hand, we recognize that giving people advice is often not as useful as helping them find their own path. But on the other hand, we try to recognize that in some cultures or in some communities, the therapist is treated as someone who gives advice. And if you just straight up refuse, then you're going to come across like you're really clueless about sort of their culture and why they're coming to you. On the other hand, on the third hand, I don't know, you can't just assume that just because someone is from a given culture, that means they want advice from you, because that's just as wrong as assuming that advice is bad. So basically, understand that the therapist won't always have all of this in mind, and sometimes you do have to really advocate for yourself and tell them what you want. But yeah, that can be hard when there's a power difference and when you don't always know what you want. Sometimes we're in therapy because we're not sure what we need to get better, or else maybe we could have done it by ourselves even.
I'm realizing during this discussion some element of my privilege, which is that given my sort of educational, my class background, I've been sort of socialized to expect that at least in sort of professional situations, I'm in control. And I've never really had an issue with sort of asserting my needs with my therapist, who I consider, I'm now thinking this may be a terrible thing, but to be my therapist. And so what I did this recently, I guess, and I guess a little story might help illustrate it, which is that the most recent bout of therapy I've done, I went to see someone because I was experiencing very intense feelings of anger after a lot of the protesting and being marching and things like that in Ferguson, Missouri, and St. Louis after the stuff that's been happening here. And I was unable to sleep, and I was just very, very angry all the time, like teeth-grittingly, like heart-racingly angry a lot of the time. And I realized it was affecting my relationships and my ability to work properly. I wasn't the most pleasant person to be around, so I wanted to see someone about that and to get down to the root of why I was so furious about it, which may seem obvious, but I felt like there was some part of my reaction that was a little intense. And I went to this person who I found through this clergy care network who provide people for this purpose, and I told them in the first session, this is the specific issue that brings me to you, and I really need to deal with this because it's impacting my life right now, and this is what I want to talk about. And the response of the therapist was to to start what I felt like was the normal process, the sort of normal intake process where let's start with your childhood, then we move on to your young adulthood, and yada yada. And after the first session of that, like at the end of the session, I was like, I'm sure this is very valuable to you. It's not actually what I came to talk about. And if you can give me a sense of how us talking about this will help me deal with the issue I came to you about, I'm totally okay going through that process, but I don't want to go through the motions of this if I don't know how it's going to get to where I want to get to. And he seemed quite taken aback, I have to say. He didn't really know how to respond to that. And when in the second session it was just a sort of continuation of that process, and I kind of articulated at the beginning again that I was here for a specific thing, and I really wanted to work out some sort of ethical and sort of existential questions it was raising for me that were very present for me, and I needed it now because it was happening now, and I needed to process it now. And he didn't seem able to be flexible enough to respond. That's kind of when I decided I didn't need to see that person again, because I thought I was making very clear what I wanted, and I wasn't getting it. Now, the challenge for that is that sometimes I know that I don't know what I want, and what I think that I want is not what I actually want. And I know that I'm very good at self-deception. I mean, I went through a whole coming out process where I was dating women for 10 years and denying my own sexuality, and I would have loved a therapist to be more assertive with me and to say, you know, maybe this is terrible misconduct, but I wanted someone to say, maybe not my therapist, like, James, I think you're gay, you have to get over it. Like, that would have been a great thing for someone to say. So I think it's a very difficult balance, but I'm usually quite direct about what I want and what I need, and even whether I'm getting it. And if I don't feel I'm getting it, I'll just kind of end the relationship.
What you brought up about, you know, wanting a therapist to tell you that maybe you're gay, we actually talked about that in one of my classes this week. And it was a really interesting conversation because it was this idea of what do you do when you have a client who is clearly struggling with some aspect of their sexuality, and you want to tell them, like, hey, you know, it's okay if you're gay, but you also don't want to, like, push them into an identity that might not fit for them. And how do you be like, so I'm not saying that you're necessarily gay, but it would be totally okay if you are gay, but it's also okay to not be gay, but to just try out experiences with people of the same gender, but it's also okay to like, how do you do that? That is really hard. So I guess my whole point with that is that, like, there really is no one-size-fits-all approach. Like, there are a lot of people, both gay and otherwise, who would have been horrified if a therapist said, maybe you're gay. Or maybe another way of putting that might be useful, like saying something like, I've noticed you've had a lot of, you know, issues in your relationships with women. I wonder if you've ever thought about seeing men or something. You know, there's a lot of ways to sort of get at the same issue.
Yeah, I think it's very difficult. I don't know what anyone could have done in that situation, but I do think that there is something very important in the therapist's role about identifying the ways that their client, their patient, I'm not sure what the correct term is self-deceiving, and trying to help them stop self-deceiving. Because sometimes other people do see things about you that you don't see. Like when I came out to my sister, her response was, oh my God, at last. I was like, well, what do you mean? Like, I've been struggling with this for 10 years. Can you just tell me? Like, seriously. But of course she couldn't. But there is a sense in which maybe if there are people, like if people are trained to be able to understand people's psychological self-manipulation, it would be great if they could sometimes kind of pierce it. Like, I do think I want a therapist to sometimes play the role of bullshit destroyer. And I think that's very difficult and delicate, but sometimes I want them to go, no, James, I think you're lying to yourself. I love you, man. I don't know why this guy has become a sort of bro-ish therapist, but I love you, man. But you have to stop lying to yourself about this thing where you're going to be unhappy. And then I may be like, I hate this therapist, and I'm like, oh, they're right. It's like a movie, like Good Will Hunting at the end.
I had, God, story's not nearly as hilarious as this. My current therapist has helped me figure out words for what's going on with me, and she's been sometimes she just lets me ramble for 5-10 minutes while she takes notes, and then she's like, "This is I'm noticing this. You're talking about sometimes leaving the scene in your brain and just not wanting and just having your body there. You know, I think that's a little bit of this dissociation. What do you think? And having it snap together, going, oh, that's what that is. Or having her like tell me you're exhibiting signs of PTSD, and you probably have for a while, and you seem to put up with a lot of crap because of it. And just having that awakening of someone just, again, piercing through the bullshit to get to exactly what's going on so that we can talk about this and get through whatever this is, whatever the real issue is. That's something I think we can hopefully all appreciate in someone we're hiring to help us out.
Can I just, if I can just respond very briefly to that, I had a very similar experience to yours very recently. On Wednesday, I went to a summit on clergy care, which is all about self-care, particularly in response to a lot of people being in the streets and being tear gassed and rubber bulleted and stuff like that after what happened in Ferguson. And one of the things that really helped me out of that was simply seeing someone put on the screen a chart of a community's reaction to a crisis and how that tends to affect communities and individuals in communities in general. And it was just being presented with a model of, this is what seems like a reasonably standard reaction when this sort of thing happens in communities. And being able to sort of plot, oh yeah, I was there on that day. That's when I had my disillusionment moments. And now I'm kind of in this phase. And I think that's one of the things that therapists can provide if they're well trained, is that they have models of general human behavior. And they don't want to put one on you, but they can sometimes offer one which fits your experience, and it's like, oh, I'm not alone in this. There's a name for that. There are stages of that thing. I've gone through 4 of those stages. Maybe I'm going to go to the 5th one. And that somehow makes your life feel a bit more controllable, because other people have gone through it before and they've got through the end of it. And that was very helpful for me even just this week.
I think a good therapist treats some of these theories or models as hypotheses to be tested. And you test them by sort of bringing them up with the client in the way that's like appropriate. So, for instance, you might say something like, you know, some people have difficulty dating after they've experienced sexual assault, you know, if that's something that's come up in the session. I wonder if you think that might be playing into some of the issues that you're bringing up. And then they feel validated and like, oh, wow, so after what I've gone through, no wonder I'm having some of these problems. And then they're able to tell you if they think that that makes sense. And sometimes the client will be like, no, I don't think that really has anything to do with it. And it can be that tempting for a therapist to be like, ooh, they're in denial. I have to show them that they're in denial. Like, maybe, but I also, when I see that reaction, I'm like, no, you know, for some reason this doesn't resonate for them. At least not yet, and there's no reason to keep pushing a theory that hasn't been supported by the evidence. We actually have some questions in the chat room that we might want to take since we're nearing the end. Somebody asks, what do we think of the usage of Myers-Briggs type in therapy? And I'll answer that from my perspective. It doesn't seem to be grounded in evidence, which means that I don't think that there's any point to bringing it up, especially since, like, categorizing yourself as a particular personality type can be useful in social situations for being like, oh, I'm totally an introvert, that's why, whatever. But in therapy, I think the point is to respect the client's individuality and not try to like come up with like the ultimate one-size-fits-all explanation of why they are who they are. But do any of you have any thoughts about Myers-Briggs and therapy?
That's pretty much my issue with it in general, is that it's too cut and paste. I mean, I use it as a way to figure out characters when I'm writing something. But other than that, I mean, it was cool taking a little test, finding out, oh, I'm an ITSWXYZ, and that's really cool. But people are fluid in so many different ways. So yeah, I would probably refuse if any therapist of mine wanted me to take a test for the Myers-Briggs.
Yes. Yeah, we also shouldn't throw the baby out with the bathwater because while the whole like Myers-Briggs like four-letter thing might not be grounded in evidence, the distinction between extrovert and introvert might be. And it might not be quite that simple, but there's evidence that people who consider themselves introverts are also more likely to be what we call a highly sensitive person, which is, I find, a super annoying, one of my least favorite psychology terms, but a legitimate term for people who like it takes a lot less sensation to sort of overload their brain. And these tend to be people who are unlikely to seek a lot of like high risk activities or exciting stuff or adrenaline boosting things. And that's interesting because introversion, it's not about being unfriendly or antisocial or anything like that. It's about being easily overwhelmed by there just being too many people to, sort of deal with and too much stimuli to process. So that actually makes a lot of sense, and it can be really helpful to identify yourself as one or the other to explain why you can't do the whole being around a lot of people thing, or maybe why that's how you prefer to socialize. So we're gonna, since we have a few other questions, we'll go ahead and move on. Someone said, does the panel have thoughts about how long or how many visits you should expect to see a therapist? What do you all think?
I've gone to see therapists for two different sorts of reasons. The first is sort of in a crisis when I needed someone to talk to about something very specific I was dealing with at that time. And I've tended to feel like I'll see that person until I feel like that crisis has passed. I'm not even sure if there's a good way to do it, but that's what my practice has been. But then after I became more comfortable with the idea and I started seeing the value, I started to think of it more as a process of self-evaluation and learning about myself that had validity even when I was not in a situation where I felt like I needed it essentially. And so I've tried to maintain a long-term relationship with someone because I like the sort of work you do with a good therapist. I've learned things about myself that have made me, more effective professionally, that have made my relationships better. It's been a good part of my overall functioning as a human being. And so I prefer to now try and maintain a sort of reasonably regular relationship where I'll see someone every month or a couple months. But what I don't try and do is what my most recent therapist wanted, which is see them every week. I feel like that's a lot, and I don't know whether I could deal with that. For me, like once a month is perfectly fine.
Yeah, there are some modes of therapy that are intended to be completed in 10 or 12 sessions. And that's usually CBT, cognitive behavioral therapy, for like a very specific concern. So for instance, you have a lot of anxiety or I don't know, you're dealing with a lot of stress from school, because it sort of takes a particular problem and gives you cognitive and behavioral solutions for that problem. However, if your issues are stemming more from what we call maladaptive schemas, which sort of these very, very deep down beliefs that you have. For instance, one might be, if I really open up to someone, they will always leave me. So that's one that I have, for instance, and I have had that for many, many, many years, and 10 sessions is not gonna get rid of that. So if that's the sort of thing that you're addressing, you might be looking at months or even years. It can also be months or years for trauma recovery. And I think here it's really the responsibility of the therapist to keep themselves accountable and be honest with themselves about like how much good they're doing you. There are unethical therapists who sort of want to try to convince their client to stay for as long as possible. That is disgraceful and should never happen. They should let you go when you're ready to go.
I fall under the as long as it takes umbrella because, I mean, that's just it. It's just as long as you need, as long as it needs to take.
So we're just about out of time, but before we wrap up, someone else in the chat room wants to know if we prefer, like for ourselves, the term client or patient. So we can just wrap up with that. I prefer client. I associate patient with the medical model, and that's not really how I see therapy for myself.
I would say I'm the opposite. I prefer patient because I'm sick.
I wish I had a really principled answer to this question. I think the way that I interact with my therapists, I think that they would be pretty clear that I think I'm their client or their employer or something like that. But I've never really thought of the question. I certainly was resistant to therapy initially because I felt like if I admitted I was a patient, it meant that I was sick, and I didn't want to think of myself as mentally sick because I think I had a series of stereotypes, negative stereotypes about what that meant. Now I don't mind that so much, but I still don't. I just have a thing about being ill in any capacity. I kind of hate hospitals. It's like a thing. Maybe I should see a therapist about this. I should probably talk to them about it. So I guess I prefer to think of it as a sort of a professional collaboration. That sounds such an arsehole thing to say.
Do you have your own word that you would prefer?
You know, I just, you asking that question triggered in me. I kind of hate what a lot of life coaches actually do, but I kind of feel like that phrase is an appropriate way that I want to think about my relationship with a therapist.
Mm-hmm. Yeah, so maybe next FtBCon, a whole panel on what do we call the person who comes to therapy. So thank you all so much for an amazing discussion, and I hope those of you watching will stick around for the rest of this weekend. We have a lot of wonderful things planned. As a reminder, you can go to ftbcon.org to see what that is. Thank you all so much, and have a good night.